everyone. My name is Daniela, and I'm a volunteer with For a Safer Space. Today's presentation is on mood disorders. I would like to begin this presentation with a land acknowledgement. I am conducting this presentation on the traditional territory of the Mississaugas of Scugog Island. While it is important to acknowledge which land I'm on, it is equally as important to understand why we engage in a land acknowledgement. First, acknowledging the land is an act of decolonization. Decolonization is an act that aims to reverse colonialism. It is also significant in understanding history and acknowledging history, as well as showing respect for indigenous peoples and their relationship to the land. However, it is important to not only use the land acknowledgement, but to educate ourselves on historical and current issues, stand with indigenous peoples in the pursuit of social justice, and decolonize our thoughts and actions. Today's agenda will include a brief introduction, followed by what are mood disorders, types of mood disorders, statistics, risk factors, warning signs, treatment, comorbidity and mood disorders, misconceptions about mood disorders, coping with mood disorders, supporting someone living with a mood disorder, supporting the client, and to conclude, resources and key takeaways will be discussed. Mood disorders are a type of mental health disability that impacts emotional states and mood, resulting in it being inconsistent with circumstances and impacting the ability to function in day-to-day life. Anyone can develop a mood disorder, however mood disorders can impact youth differently than adults. There are various types of mood disorders, with the 5 most common being major depressive disorder, dysthymia, bipolar disorder, medically related mood disorders, and substance-induced mood disorders. There are options to help cope with mood disorders that can be beneficial. What are mood disorders? Mood disorders are a type of mental health disability that impacts emotional states and mood, resulting in it being inconsistent with circumstances and can impact the ability to function in day-to-day life. Moods can vary, with some experiencing extreme sadness, hopelessness, and irritability, or experiencing moments of excessive happiness. Mood disorders can be impacted by anxiety, as anxiety affects mood and can be comorbid with depression. Mood disorders can affect people of all ages, however may impact adults differently than youth. This next section will cover types of mood disorders with a brief introduction into various mood disorders, which will be followed by a discussion of the 5 most common mood disorders. This will include major depressive disorder, dysthymia or dysthymic disorder, bipolar disorder, medically related mood disorders, and substance-induced mood disorder. Types of mood disorders. Introduction. There are various types of mood disorders. Some examples include major depressive disorder, which is prolonged and continuous feelings of sadness, bipolar disorder, which is a mood disorder that can fluctuate between periods of depression and mania, seasonal affective disorder, or SAD, which is depression that is related to the lack of hours of daylight and can fluctuate with the seasons. Encyclothymic disorder, which is similar to bipolar disorder, mood shifts occur but can be less extreme. Premenstrual dysphoric disorder is mood shifts and irritability that occurs during the premenstrual phase and can go away after this period of time. Persistent depressive disorder, or dysthymia, is a chronic and long-term type of depression. Disruptive mood dysregulation disorder occurs in children and includes chronic irritability that results with outbursts that do not align with the child's age. Mood disorders related to medical illness can be a continuous depressed mood that is correlated to the physical effects of another medical condition. And finally, substance-induced mood disorder results in symptoms that derive during or soon after the use or withdrawal of a substance or medication. Major depressive disorder. To build on looking at this type of mood disorder, it results in persistent feelings of sadness and loss of interest in what was previously enjoyable. This can impact feelings, thoughts, and behaviors, which can create difficulties with daily functioning. Some common symptoms of major depressive disorder include feelings of sadness or hopelessness, irritability or frustration, problems with sleeping patterns, lack of energy, feelings of worthlessness or guilt, difficulties thinking, concentrating, suicidal thinking, and unexplained physical concerns, such as back pain. Depression in children and teenagers can show up slightly differently. In younger children, some common signs include sadness, irritability, clinginess, worry, aches and pains, not wanting to go to school, or weight concerns. In teenagers, symptoms can include sadness, irritability, negativity, feelings of worthlessness, poor performance or attendance in school, using substances, changes in eating or sleeping habits, self-harm, loss of interest in activities they once enjoyed, and social isolation. In adults, depression symptoms can include memory issues or personality changes, physical aches and pain, fatigue, changes in appetite, sleep habits, or loss of interest in sex, social isolation, or suicidal thinking. Dysthymia or dysthymic disorder. This is another name for persistent depressive disorder, which is persistent long-term depression. It consists of the general feelings of depression. However, this can persist for years and impact relationships, work, school, or daily activities in large ways. Symptoms can come and go over the course of years, and during each period where symptoms do come back, their intensity can vary. Common symptoms include little interest in daily activities, sadness or emptiness, hopelessness, a lack of energy, low self-esteem with high levels of self-criticism, difficulties concentrating and with decision-making, irritability, decreased activity, effectiveness and productivity, social isolation and avoidance, feelings of guilt over the past, poor eating habits, and sleep issues. Bipolar disorder. This results in extreme mood swings that include highs known as mania and lows known as depression. During depressed episodes, there are feelings of sadness, hopelessness, and a loss of interest in most activities. However, when moods shift to mania, someone may feel euphoric and full of energy. These mood swings can occur rarely or multiple times in a year. Mood shifts can impact every aspect of life, including sleep patterns, energy levels, judgment, behavior, and thinking. There are types of bipolar disorders which include bipolar I disorder, bipolar II disorder, cyclothymic disorder, among other types that can result from substance use or medical conditions. Medically related mood disorders. This type of mood disorder results from physical conditions and health issues that result in mood disorders and heavily impact daily life. Medical conditions that can result in mood disorders include neurological disorders such as Huntington's disease, Parkinson's disease, or Alzheimer's, heart attacks, pancreatic diseases, thyroid concerns, cancer, infections, or inflammatory bowel disease. It is important in these cases that the underlying physical health concern is also addressed with the mood disorder. Substance-induced mood disorder. This is an alteration in thinking, feeling, or behaviors that results from taking or stopping a particular substance. The act of taking or stopping a substance, whether illicit or medical, can result in changes in brain chemistry that impact behavior and thinking processes. Symptoms can occur while using the substance or a few days after stopping use, and can include typical depression and mania symptoms. Now we will briefly look over statistics to see how many individuals are impacted by mood disorders. Within the United States, it shows that about 1 in 5 are living with a mental health disability, which includes mood disorders. Of this population, 20.9 million of those 18 or older are estimated to have a mood disorder. One study found specific statistics that shows that within the U.S. adult population, about 9.7% had a mood disorder within the last year. In any year, mood disorders were higher in females than males, with 11.6% of females being impacted and 7.7% of males. About 21.4% of adults will live with a mood disorder during their life, and about 45% of individuals living with a mood disorder will have some form of serious impact due to the mental health disability. Risk factors. There can be various factors that result in a mood disorder, which can be influenced by the type of disorder. Genetic, biological, environmental, and other factors can all play a role in the development of mood disorders. Some specific risk factors include family history of mental health disabilities, particularly with mood disorders, previous diagnosis of a mood disorder, trauma, stress, or major life changes, physical illnesses, or the use of particular medications. For instance, depression has been correlated to diseases like cancer, diabetes, heart disease, and others. And finally, brain structure or function, which is common in bipolar disorder. Warning signs. Warning signs can vary depending on age and the type of mood disorder, and the feelings can be more extreme than what is typically felt. This can impact an individual's interactions with family, friends, community, and work. Some general common signs of mood disorders include persistent sadness, feelings of hopelessness, guilt, or worthlessness, low self-esteem, suicidal thinking, loss of interest in normal activities, issues with sleeping, relationships, or appetite, lower levels of energy, difficulties concentrating or making decisions, physical aches and pains, increased sensitivity to rejection or failure, and irritability. Treatment. There are a couple of treatment options for mood disorders, including psychotherapy and medication. Psychotherapy can assist in helping alter views of oneself and the environment around them. It can also assist in interpersonal relationship skills, as well as noting stressors in the environment and learning how to avoid or cope with them. As well, medication is an option, which includes antidepressants and mood-stabilizing medications. It will be dependent on the particular mood disorder. It is important to note with medication, depending on which is used, it can take weeks or months for someone to find one that works, or for the medication itself to begin working. This next section will discuss comorbidity in mood disorders. However, I think it's important to have a foundation of knowledge on what comorbidity is. Comorbidity can be defined as the prevalence of two or more illnesses in the same individual, either co-occurring or one after the other. There can also be an interaction within the illnesses that can negatively impact both. Now that we have an understanding on what comorbidity is, it is easier to see the connection between mood disorders and other mental health disabilities. It has already been established that mood disorders can be correlated to physical health concerns. However, it is also quite common for other mental health disabilities to be comorbid with mood disorders. The most commonly comorbid mental health disabilities include anxiety and depression. In fact, one study found that 51% of those living with major depressive disorder also had at least one anxiety disorder. Misconceptions about mood disorders. There are various misconceptions surrounding mood disorders, and we'll take a couple of minutes to deconstruct them. This is an important step in better understanding the mental health disabilities and deconstructing the stigma around it, as these misconceptions spread misinformation and can stereotype individuals living with it. The first misconception is mood disorders show weakness or lack of self-control. Mood disorders are not a sign of weakness or self-control. They can impact someone's ability to function, such as through getting out of bed, but it is not within the individual's control. When someone experiences a mood disorder, it can impact various aspects of functioning that make it difficult to do certain tasks, but it is not due to weaknesses but changes in brain chemistry. Additionally, mood swings always mean that someone has bipolar disorder. Mood swings are not always a sign of bipolar disorder. This spreads misinformation, as a variety of factors can cause mood swings, such as physical health concerns, diet, stressors, substance use, changes in sleep habit, or diet. Only adults live with mood disorders. Youth of all ages can also develop mood disorders. This derives from the belief that youth cannot develop mental health concerns due to the lack of stressors that adults experience. But this is untrue. This results in youth not reaching out for help and can have serious consequences on mental health. And finally, only people who experience trauma or hardship develop mood disorders. This is untrue, as there are many reasons why someone may develop a mood disorder, such as genetics. While trauma and lived experiences can impact the risk of developing a mood disorder, not everyone who has one will live through major trauma. This misconception spreads misinformation that harms, as it can invalidate someone's lived experiences and lead to individuals keeping their mental health a secret. Coping with mood disorders. There are various ways that someone can cope with a mood disorder and their symptoms. Some methods may differ based off the type of mood disorder and individual needs, but we'll go over some methods that can be beneficial. The first one being acceptance. This can be difficult, especially as many feel that mental health disabilities greatly impact their life. And while they can, studies show that moves towards acceptance can be beneficial. This is because acceptance can lead to individuals focusing on themselves and their mental health, ensuring that they take care of themselves. Another method is deep breathing. This can be beneficial, especially during times of stress. It can provide a few moments to stop and think, while the heart slows its pace and relaxes. Grounding through the five senses. This can help, as in lieu of focusing on one particular object, it provides a distraction through focusing on all the senses, such as what you see, hear, smell, feel, and taste, as it can allow someone to stay in the present moment. And finally, being aware of emotions. It is also important to stay aware of current emotions. From there, it can be easier to see where they come from and work to accept and ground oneself. Supporting someone living with a mood disorder. Similar to the individuality of coping methods, methods of support will also differ based on the individual. However, there can be a few key things to keep in mind. First is help them reach out. It can be difficult for individuals living with a mental health disability to reach out for professional help. However, it can be a critical step. Helping them to find professional supports can ensure that they do not go through the process alone. Learn more about the mood disorder. Knowledge can be a powerful tool, and learning more about symptoms, risks, and other details about mood disorders can assist in supporting, as knowledge can equip someone with the background information on certain thought processes and behaviors. Be patient. Patience can be important, as it can take time for someone's mental health to improve. Create crisis plans. In the event a crisis does occur, it can be beneficial to discuss with the individual what the plan is, what they're going to need, and how to best support them. Once the plan is created, it can help in the event of a crisis, so that there are not as many feelings of being overwhelmed, and there is a guide to help. Most important is self-care. Understanding your own limits, creating boundaries, and ensuring that you take care of your own mental well-being is significant. Supporting a client. There are various steps practitioners can take to best support clients living with mood disorders. However, specific tools provided will differ based off of the mood disorders. Some important things to keep in mind include remain judgment-free and ensure clients' needs are in focus. Remember that trusting relationships take time. It can take time for clients to truly open up and feel safe, and that is normal. What is important is remembering that it does take time, and it is best to ensure welcoming and safe environments. And finally, discuss goals. Having goals for therapy can be beneficial, as it helps to understand what the client wants to get out of it, and can also help to structure sessions moving forward. Now we'll go over resources. The most important thing to take away from this video is that there are supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. To conclude, we'll go over some key takeaways. Mood disorders are a type of mental health disability that impacts emotional states and mood, resulting in it being inconsistent with circumstances and impacting the ability to function in day-to-day life. There are various types of mood disorders, with the 5 most common being major depressive disorder, dysthymia, bipolar disorder, medically related mood disorders, and substance-induced mood disorders. There are various risk factors for mood disorders, which can include genetic, biological, environmental, and other factors. As well, there are several warning signs for mood disorders, which can be dependent on the type of mood disorder. Treatment options for mood disorders include psychotherapy and medication. Mood disorders can also be comorbid with other physical or mental illnesses. Additionally, there are many misconceptions about mood disorders that harm those living with them through stereotype, stigma, and misinformation spread. There are steps to cope with mood disorders, but individuals may find that methods may differ. Similarly, there are ways to support those living with mood disorders, but it is important to center self-care. Finally, practitioner methods to support clients will differ based on the type of mood disorder. However, there are some key methods beneficial to working with any client. That concludes this presentation on mood disorders. Thank you for watching.